so I got a provision placed in the bill that gives insurance commissioners in the state, as insurance commissioners have, the ability to, one, require publication of premium increases. Right now there's no publication really or dissemination of premium increases, and so you don't know from one employer to the next whether you're getting a 30% increase and somebody else is getting a 10% increase. You have no way of knowing, and so it requires the dissemination of insurance increases, and then says to the insurance commissioners that you have the ability to make a determination as to whether those increases are reasonable or are they excessive. And if you determine that they're excessive, the insurers that are determined to have put into place excessive premium increases will be prohibited from competing for all those new customers who are now in the marketplace. I think that this is a great incentive for the companies to look reasonably at their at their costs, but that's a whole level of work now that is going to be taken on by the insurance commissioners, and there's a provision in the legislation that gives states assistance to be able to have the kind of oversight that they need, and so that's another takeaway for our governor. And then let's see if there are many more, but those are a couple of the highlights. Thank you. Yes.
I first have to commend you. You have a much richer understanding of the healthcare bill than many of your colleagues, which I had some of the same disappointments. The one thing I have to beg you to hold the ground on is that primary care focus. Even if it's FQHC, it's primary care, if it's OBGYN, even those are frontline supporters. It's become very, very difficult to get into primary care. These people are struggling to even make a living, and frankly, they are the key to medicine. They define medicine. We don't need more plastic surgeons, in all due respect. We need more primary care doctors. So the more you can do to support that specialty, the better off we'll all be, including hospitals. I mean, I'm attenuating this one step, but the more access you have to primary care, and frankly, the Massachusetts model worked very well, minus the access to primary care providers. So we need more and more focus on those individuals. And FQHCs actually have a great role in that as well. So all of that together, but keep pushing on that because we really need to focus on the primary care.
No, it's really good to hear that. It's absolutely true. I mean, the other thing that we do on Medicare, though, is also increase the payment to Medicare providers who are delivering primary care. And that's really important because then at least the existing providers say, I can make my practice work. I don't have to let go, patients and stuff, and to balance it out. And again, sort of emphasize that it's important to balance out those payments for primary care practice. But it's so amazing. I think across the board, Republicans and Democrats, I mean, everybody recognizes the horrible shortage of primary care physicians. You can see it in your own community. I mean, I know, personally, when my gynecologist retired, it was like, my gosh, trying to find one, in practice. So, and I know that there have been issues around, around tort reform, which we didn't deal with really in this bill, except to establish them, and the President did this also by executive order, to establish some procedures to begin to look at ways that we can both more efficiently and effectively deliver care, and also to ensure that there's some sort of baseline by which the practice can be judged, so that it doesn't result in at least frivolous litigation. I'm a lawyer, so I don't have anything against litigation when it's appropriate. And also, I mean, I think from just for some of these practices, and the reason I mention it is because a lot of people are afraid to go into, or not afraid, but they're troubled with going into some of these practices like OBGYN, where those insurance costs are really tremendous for the practice. Even though I also think on that we really need to have a better way of linking databases that identify bad doctors, because if you really, across the board, it's the same set of bad doctors who are, sued all the time. And so that doesn't apply to the entire field of practice or the sector, and yet it's the entire sector that's actually bearing the burden of the insurance costs for those particular practitioners. And one state doesn't share effectively with another state when doctors move from one place to another, establishing yet another bad practice. Even within our own state, there's not a lot of sharing that goes on, and so the result is that good doctors, committed doctors, end up bearing the brunt of that through their insurance premiums.
Yes.
You are hosting a nonprofit summit. Is some of the driving behind that the building of capacities of local nonprofits, and do you see that benefiting nonprofits that don't necessarily provide direct medical service, but maybe some of the wraparound services that might be required?
Yeah, I want to separate that. I am hosting a nonprofit forum. It's this week, 23rd. The 23rd. I'm looking at Desmond, at the Prince George's County Sports and Learning Complex, starting at 8:30 in the morning. And the reason I come out of nonprofits, and I believe. I believe in a strong and robust nonprofit community that really supports what government is trying to do and what business is trying to do in a community. One of the things that I know to be true is that here in Prince George's County we have thousands of nonprofits, all operating at the margins, under $25,000 a year, and a lot of folks who actually are all doing the same things because they have a good idea. And I know, having run nonprofits before and also having funded them, that there has to be an evaluation mechanism. You've got to say, well, if you're doing, services for formerly incarcerated people, and somebody else is doing that same set of services, and each of you is only handling a handful of clients, why not partner and then put yourself in a position to get a federal grant or a state grant? And what happens is, and I know this from my own 20 years in the nonprofit sector, is that you just think it's your good idea, and you're just going to go out there, and it's actually made a lot of our nonprofit sector actually marginal and ineffective. And so my interest is in strengthening the capacity of nonprofit organizations, helping people understand how they have to build their boards, how they have to have financial accountability, and recognizing that they have to raise money from diverse sources. What happens in an environment like this are nonprofits that rely almost exclusively on federal or state or local money just take the biggest hit in an economy like this because they haven't diversified their funding sources. They haven't thought strategically about how to build their organization, and so we're doing that, and hopefully we'll get good turnout. We've got a lot of federal agencies that do grant making. One of the big shockers here in Prince George's County is that our federal agencies, with all that money that they have out there, they make very, very, very few grants here to nonprofit organizations in our community. It's surprising, given the proximity and the fact that so many of the grants officers live in Prince George's County. And so we're pulling a lot of those folks together to help nonprofits think through how to apply for these grants, state people, some private funders. But it comes out of just my interest in, if you're going to have a nonprofit sector, it ought to be robust.
Kerry Morgan, KPM Foundation. I appreciate you saying that, thinking outside the box. A few months ago, I went to the division of Prince George's County. And then last week, I had an Energy and Climate Conference with Secretary of State Hillary Clinton and Dr. Stephen Chu, and 30 other countries as well. I learned that we're having a problem of partnering and teaming up together. And it was quite astounding to me because I was telling people, I'm with a lot of youth, young adults. I'm with a lot of veterans who are interested in going to renewable energy, being energy efficient, better air. So my question to you is, what is your objectives and goals, and how do you think we should progress and move forward and start getting away from all these different things of being separate but being together?